Hello, my name is Wilkins, and I will be talking about the rehabilitation program that I chose for this week's assignment and video. So, the first case that I selected, or the case that I wanted to, was the 22-year-old male basketball player with a grade 2 lateral ankle sprain involving the anterior talofibular ligament and calcaneofibular ligament. First of all, before I explain a little bit about it, is I chose this because I am a basketball player. I played basketball my whole life. I have countless of friends who are basketball players, and I also sustained an injury in the ankle when I was playing for my high school varsity team. It took me about 2 to 3 weeks of rehab, so I kind of wanted to learn a little bit more about stuff that I should have done back then when I was going through that. You know, we're young, we do a lot of stuff, but not the correct way. We think everything's gonna heal and not do the work that we got to, right? So this case, the injury occurred about 5 days ago, he said, and after he landed awkwardly from a rebound of basketball. He currently presents with mild swelling around the lateral malleolus, improving but still altered. It still alters his gait mechanics, poor single leg balance and apprehension with cotton movements. His goal is to return to competitive recreational basketball within 5 weeks for the playoff. For my rehab diagnosis, I prioritize three main impairments as my X factor. First of all is ankle proprioception deficits, reduced ankle mobility, and pain swelling. So these are three important factors when we have an ankle injury. You know, we are afraid to move it, we are afraid to stand on it, and the more the ankle is not moved or rehab, the more we lose all of this. So my first priority is going to be proprioception because basketball requires a constant single leg control during jumping, landing, cutting. When you shoot, you're on a 2 leg, but when you're going on a layup, you're on 1 leg. So all this is really important when we're doing a rehab, understanding the sport. His inability to maintain a single leg balance indicates that there's decreased ability of the ankle to respond to external forces, increasing his risk to sprains. My second priority was to be ankle mobility, especially dorsiflexion, because adequate ankle motion is necessary for proper squatting, landing mechanics, and changing of direction movements. My third priority is managing pain and swelling because excessive symptoms can inhibit muscle activation, limit movement quality, and delay progression. Although strength deficits are important, I will not prioritize them above this impairment at this stage because pain, swelling, and poor neuromuscular control are likely contributing to decreased strength output. So addressing this issue will allow the strength training to be more effective, right? So for my highlights, during this current phase of rehab, the goal is to restore basic function while gradually increasing the athlete's tolerance loading. The exercise program begins with ankle mobility exercises, including ankle circles and controlled dorsiflexion and plantar flexion movements. These exercises are selected because early motion helps restore range of motion and prevent stiffness without placing excessive stress on the healing ligament. The athlete will also perform calf stretching and resistant ankle strengthening using resistance band. Strengthening the muscles surrounding the ankle, especially the everters, help improve dynamic stability and provides additional protection for the injured ligaments. For the dosage mobility of these exercises, they will be performed multiple times throughout the day, and they will be done 10 to 15 repetitions. Resistant exercises will be completed for 2 to 3 sets of 12 to 15 repetitions using light to moderate resistance. The athlete will also perform balance exercises daily for 3 to 5 sets of 30-second holds. Single leg balance training is a major component because the athlete sports require frequent single leg landings and rapid changes of direction. If you've ever seen a basketball player, the most thing they do is change direction. As a basketball player, you need to be fast, you need to be able to change position, you need to be able to predict, and those split predictions also make your body react. So most of the time we're making and putting a lot of excessive loads into our not only our ankle but our knees for those fast-paced movement. So this exercise will begin on a stable surface and progress forward to more challenging conditions as the control improve. It could be a single board where the athlete is trying to like hold himself while someone's throwing a ball. Just work through that whole area of a single leg balance training, right? So the criteria for progressing to the next phase include minimal swelling. We want to reduce swelling. Pain levels remaining low during and after exercise. Normal walking mechanics. Near full ankle range of motion. Ability to maintain single leg balance for at least 30 seconds with good control. And completion of strengthening exercises without symptom aggravation. Once these criteria are met, rehab and progression toward more dynamic activities such as jogging, jumping, and basketball specific agility drills could be performed. So one of the things that I want to to put out there is that a lot of the athletes, they come in, they want to rehab for a week, and then that second week they want to start shooting. They want to be like Kobe. Kobe would shoot with the other hand, with his hand broken, but with the ankle, we really got to be careful with it. We really have to take the time to rehab it, because once you injured your ankle, and if you don't do it right, it will subsequently bring on more problems. I did not rehab it right, and when I went to play on my third week after my injury, because it took me like about 2 to 3 weeks. After that, when I went to play, I could not shoot. I've had intense pain. I could not move well. So it's pretty important to stress, the time and effort that it takes to rehab an ankle for someone who's playing. So in my clinical recent sequence, right, why did I choose the single leg balance? Is because my decision, including the single leg balance training, is because the main limitation is decreased proprioception and neuromuscular control after the ankle sprain. So this is demonstrated by his inability to maintain single leg balance without significant sway. What must adapt, right? What is needed is to improve sensory motor control, including better communication between ankle joint and muscles and nervous system. And at 5 days post injuries, the athlete can tolerate controlled weight-bearing activities as long as pain and swelling remain controlled. What intervention addresses this? Simple. These exercises are appropriate because they challenge ankle stability in a controlled environment. Like I said, this athlete will perform 3 to 5 repetitions of 30-second holds daily and progression based on symptom response. I will monitor pain levels, swelling, amount of ankle sway, and ability to maintain balance without compensation. And again, what is required to progress from this single leg balance will be demonstrate consistent balance for at least 30 seconds without increased symptoms. And how does it evolve towards the sport is that balance training will progress into dynamic movements such as single leg hops, lateral movement, cutting drills, and basketball specific landings. My second decision was including resistant band strengthening exercises because he has reduced ankle stabilizer and activation due to pain and ligament injury. A strength deficit can contribute to future instability. He must regain strength and endurance to provide dynamic support during basketball movement. If the athlete can tolerate low to moderate strengthening exercises or resistant exercises, they create controlled loading without excessive stress on the healing ligaments. Resistant band strengthening in multiple directions was selected to target muscles responsible for ankle stability. The difference from this is that he will perform 2 to 3 sets of 12 to 15 repetitions with moderate resistance while maintaining proper quality. I will monitor again pain during exercises, swelling afterward, movement compensation, and the athlete's ability to complete repetitions with control. He must complete the strengthening exercises without functional movement. He must without increased pain and demonstrate improved ankle control to actually come up forward. Strengthening will progress from isolated ankle exercises to functional movements such as squats, lunges, jumping, and cutting drills that replicate basketball demands. I believe that the role that the manual therapy plays in this rehabilitation plan should be used as an adjunct rather than a primary treatment. It primarily answers the reasoning question, what intervention can improve the athlete's current limitation, right? For example, talocrural joint mobilization may help improve dorsiflexion mobility and reduce stiffness. Improving ankle motion can allow the athlete to perform active exercises such as squats, balance training, and proper landing mechanics more effectively. However, the main focus remains active rehabilitation because restoring strength, proprioception, and sport-specific movement is what ultimately prepare the athlete for a safe return for basketball. Thank you.